Very good afternoon, everyone. I'm Satakshi. Greetings from Human Biological Institute. Welcome to yet another engaging session of our scientific forum. We talk, do you? At Human Biological Institute, we take immense pride in driving several public health awareness initiatives through one of our own session feature leading expert from across the country. Delighted to have Dr. Shailaja with us for perspective on PCOS, a common cause of delayed conception. In short while, for the moment, please allow me to share a brief introduction of Human Biological Institute. Human Biological Institute, commonly known as HBI, is a division of Indian Immunologicals Limited, IIL. IIL was established in 1982 by the National Dairy Development Board as one of its units and was later incorporated as company in 1999. HBI was founded in 1998 with the Government of India request IIL to produce a modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. India enrolled out the country's first varicella rabies vaccine in year 2000. ARV, that is anti-rabies segment, and with the presence in around 60 countries. HBI has launched several other vaccines and become a major player in human vaccines segment. HBI has been a keen supplier of pentavalent vaccine to the government of India under its Universal Immunization Program, that is UIP. In yet another milestone, HBI introduced Havishure in 2024, India's first indigenous hepatitis A vaccine aimed at providing protection for both children and adults. With the vision of shaping global health, with the vision of shaping global healthcare by spread-heading the One Health initiative, the mission to innovate, produce, and market this to improve and extend. We are committed to providing affordable, high quality products through continuous technology to meet our customer needs. As a market leader, we have taken a significant step towards reducing plastic burden by 160 tons per annum through the introduction of eco-friendly packaging wrap. As a part of our corporate social responsibility initiative, we have adopted schools where IIL provides infrastructural support and basic facilities, including assistance with the midday meal program in association with NDDB. Through the gift milk program, hundreds of school going children benefit from daily milk nutrition. We have also donated an oxygen generation plant to Telangana Institute of Medical Sciences, that is TIMS. These are some few highlights about IIL. For more, www.indieimmune.com. Puberty to menopause is one of our unique initiative where we address a wide range of topics related to women's health and well-being. Welcome to today's episode of We Talk Do You. The session is dedicated to highly significant and often overlooked topic, that is PCOS, a common cause of delayed conception. To help us better understand this condition and its impact, we are joined today by Dr. Shailaja Talwade. We would like to begin the live talk with a short welcome video that introduces our guest speaker and shares a brief overview of her expertise. We are honored to welcome Dr. Shailaja Talwade. Dr. Shailaja Anil Kumar Talwade is the director and consultant of the Talwade Group of Hospitals. Having 23 years of experience in gynecology department, along with over 4,000 plus USG scannings every year. She has conducted. We are delighted, ma'am, to have have you with us today. Thank you so much for joining. Ma'am, you're live. Uh, you're live and welcome for this live session today. Thank you so much for joining with us today for discussing on the topic of PCOS.
Thank you, Satakshi. Thank you so much. Thank you for having me on this show. We talk to you. And I really thank Human Biological Limited also to have me on the show. Thank you. Thank you so much.
So, ma'am,
You can get
let's
on.
begin the today's session with some of the commonly asked questions of PCOS. So, firstly, we will go with four segments, that is understanding PCOS, and again we will ask some lifestyle and management. After that, illness and awareness questions. Looking ahead, what are some common questions in the mind of our audiences and general public? So, my first to you is, what is PCOS and how common is it among the women of reproductive age?
So PCOS is polycystic ovarian syndrome, or it's also called as polycystic ovarian disease or polycystic ovaries. All these three go hand in hand, and this is a hormonal disorder seen mainly in the women of reproductive age group. It's characterized by insulin resistance and male hormone excess. It's a very
Yes.
complex disorder with multiple reasons to blame, like sedentary lifestyle, or faulty eating habits, stressful life, or lack of sleep, spending more time in front of the screen. These are with so many things to blame for, but it is a hormonal disorder with environmental or lifestyle. Coming to how it's as common one OPD practice. having PCOS, right? Way back, we hardly
Okay.
small paragraph in our book indicating that it was that less, that is uncommon. That's I started my practice in 2002 or 3.
Yes.
We had few patients, like every day in a OPD
Yes.
of 60 to 70 I had one or two patients. It was that, but it was not that common in even 2021 20 years back. But today in my practice, the incidence is as high as 20. There is every fifth woman attending my OPD PCOS. It's become like a gynecological epidemic. Almost
Mhm.
every fifth lady. That's it.
Yes, ma'am. Yes. That was very helpful, ma'am. Thank you so much for that insight. Let's move to our next question. What are typical PCOS that people should be aware of?
See, PCOS symptoms to start with, most of the time the PCOS ladies come with menstrual problems. Maybe delayed menstruation, irregular menstruation,
Okay.
scanty flow, sometimes prolonged flow.
Mm-hmm.
Or some ladies do come with frequent menstruation also. Most of them come with menstrual irregularities. So, another symptoms which they should be aware of is
Okay. Okay.
PCOS ladies will have um, acne over the face, multiple acne, huge acne,
Okay.
and facial hair growth is also very
Mm-hmm.
commonly seen in this PCOS ladies. They come with that symptom as well. Body hair is excessive here. They have symptoms of
Mm-hmm.
alopecia, hair fall is more common. And main symptom most of my
Okay.
ladies coming these days are, I'm obese, I'm gaining weight, ma'am, and with whatever possible things I do, maybe join gym or do some dieting, whatever I do, I'm not able to lose weight. This is most common nowadays.
Yes.
They are not able to lose weight, they are gaining weight. And simply without any symptoms, they
Yes,
come to
ma'am.
us with just saying that, madam, I'm not able to conceive. Symptoms, they may not have any of these
Yes.
symptoms, but still they come saying that I don't have any problem, but I'm not able to conceive now. So these are some of the symptoms.
Mm-hmm. Okay. Thank you so much for this insightful answer, ma'am. So you have mentioned that people who are suffering from PCOS are going with some menstruation problem. So I flow of getting sustained by more than 5 days, or what kind of menstruation problem do they face?
Delayed menstruation, beta. They will not have menstruation every 28 days.
O-
So ideally, every lady should menstruate
Okay.
monthly or so. And these ladies will have delayed menstruation, maybe every 2 months, every 3 months, they'll have delayed menstruation, and their flow is scanty.
Mm,
Most of them present like this,
mm,
but some ladies do have prolonged menstruation. There is excessive,
okay.
more than 5 days or may more than 8 to 10 days or
Okay.
so. But common
Okay.
symptom is delayed menstruation here.
Okay. 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 Thank you so much, ma'am. I'm sure my audiences must be watching this and they should know and should be aware of the insights which you're giving, small points which you're giving, and so that they can also have an idea that if they are having a delayed menstruation or something like that, they should consult their doctor. Thank you so much for this answer, ma'am. My next question to you is, why does PCOS often go undiagnosed, and what can be done to improve early detection, and how do you detect PCOS?
So
It's just with the symptoms or the diagnosis thing.
okay, first thing, the symptoms are so very vague, like irregular cycles or scanty flow or acne or hirsutism or obesity. These are so very
Mhm.
vague. With only with these symptoms, patients they don't think that they must be having any disease. So I have excessive hair on my face. They don't link that to any disease. And there is no one particular test to diagnose PCOS. As you see in hypothyroid disorders, we have one particular test, T3, T4, TSH, and we diagnose
Yes.
hypothyroid as
Mhm.
hyperthyroidism. For diabetes, we have blood sugar level and HbA1c, it's diagnosed. But in PCOS, we don't have one particular test to diagnose a female to have
Okay.
PCOS. So it goes undiagnosed, and it was also the symptoms are so very vague, it goes it is delayed diagnosis. So I think these are the reasons for
Okay.
them diagnosed or for a longer time. And all the world, because we have come out with Rotterdam criteria. There is a criteria class. Of the three criteria, two should be present to diagnose a female to have PCOS. So that is the final thing now. Anybody,
Okay.
everybody nowadays, they come to our OPD with googling out. They know something about PCOS. Ma'am, I think I have PCOS, and now what to do? So it is overdiagnosed rather underdiagnosed. In my practice, I think this young girls and young college girls are diagnosing themselves as having PCOS because of googling things. And
Yes.
we
Now
doctors
people are more aware. Yes.
we doctors diagnose PCOS using Rotterdam criteria. What is Rotterdam
Yes.
criteria? There are three criteria. One criteria is menstrual irregularities. The second one is ultrasound diagnosis. And the third one is excessive androgen excess. And like it is something like acne, excessive androgen excess should be there. That is 3 points. First, second and third. Of the three criteria, the two criteria should be present to diagnose hirsutism. That is ultrasound diagnosis with menstrual irregularities or ultrasound diagnosis with androgen excess symptoms like hirsutism or acne or hair loss or obesity. So either of two criteria should be present to diagnose a female to have PCOS. This is how we will diagnose PCOS.
Okay. Okay, ma'am. So my next question to you is, ma'am, is PCOS is hereditary and certain ethnic groups are more prone to it, or is one can develop PCOS as there is no any linkage with hereditary or genes with it?
It has got a genetic background definitely, but the genetic cause is not the only
Yes.
sole cause. It will be it is associated with environmental factors. It is associated with uh, other factors, like as I've told, insulin resistance and
Mhm.
androgen excess is there, but genetic cause is
Mhm.
a background. This genetic there'll be this genetic background is not simple one cause. It is
Mhm.
actually associated with our lifestyle changes, diets, and all these things are
Mhm.
associated. It is not just genetic.
Okay.
And of course, it is
Okay.
said that our South Asian women are more prone for this because already we are pre-diabetic. We are
Mhm.
prone for metabolic disorders. So some ethnic groups are prone, but it is mainly a lifestyle disorder. Nowadays, anybody, everybody, because of the bad lifestyle habits, are prone for developing
Yes.
PCOS.
Yes, ma'am. Okay. Thank you so much, ma'am. I appreciate the clarity on that. So my next question is related to the PCOS and fertility things. That how exactly does PCOS affect the ovulation and lead to delayed conception?
Uh, See, PCOS is characterized by insulin resistance and androgen excess. These both androgen excess is what is androgen? It's a male hormone.
Yes.
Androgen excess is male hormone excess is seen in the is seen excessively in the female with PCOS.
Yes.
These male hormone excess patient agrees. So insulin resistant
Mm-hmm.
male hormone excess main cause. How it affects in PCOS, I think we'll take one or two. Ovulation occurs in a normal female. In normal female, what happens under the influence
Yes.
of if there is a cycle, hypothalamo pituitary ovarian axis, it's there. So, under the influence of
Yes.
hormones which
Yes.
are released from anterior pituitary, that is FSH and LH, this FSH and LH will act on the
Yes.
ovaries, and in there will be
Mm-hmm.
maturation of follicles. FSH will help
Yes.
follicles to mature. These follicles will mature to
Yes.
certain extent, and under the influence of LH, which is also released from
Yes.
pituitary, LH surge, there
Pituitary.
will be
Yes.
rupture of these follicles leading to the release of ovum. This tube where it waits for the sperm to come. If there is sperm present, then there will be fertilization of the ovum. In case of absence of fertilization, the endometrial
Yes.
lining and the ovum along everything will shed off, and that is menstruation. This is how it occurs. Here in our
Mhm.
PCOS patients, because of
Yes.
androgen excess hormone, these follicles will not mature properly. Instead,
Okay.
they are somewhere blocked in between. They are in. They present as small cysts. The
Okay.
complete maturation doesn't occur.
Okay.
These follicles are seen as small follicles. As I've told, ultrasound. One of the criteria for diagnosis of PCOS is ultrasound.
Yes.
This ultrasound finding shows multiple cysts, polycysts. What are these cysts?
Mhm.
These are nothing but which have matured improper rupture. No ovum is
Mhm.
released. So there will be anovulation
Mhm.
and infertility. Or if they rupture also, they don't rupture
Okay.
on time. They rupture a little late. So the
Okay.
female will have delayed cycle
Okay.
or delayed fertilization sort of. So this is how
Fertilization. Okay.
PCOS lady is affected by, which is present in PCOS
Mhm.
lady, which will affect the
Okay.
follicle maturation, follicle rupture, and hence no fertilization. I think I was
Okay.
getting it.
How wonderfully, yes, ma'am, how wonderfully you have explained this. Any layman could understand this whole journey of that hypothalamus to fertilization. Thank you so much for explaining it so well, ma'am. Thank you so much. And my next question to you is, um, can women with PCOS still conceive naturally, or is any medical intervention is required?
Say definitely yes. It is little difficult. It is little delayed, but definitely a woman with
Mhm.
PCOS will conceive naturally. It is all possibility that she will conceive
Okay.
naturally. How? Why is it delayed? I have told it is
Mhm.
little difficult. It is little delayed, but possible. Why am I telling it is little difficult and little delayed? Because we are. I just told now, just before, follicles are
Yes.
affected by androgen excess, so they don't mature at time.
Yes.
In an ideal female,
Time. Yes.
14th day there will be ovulation. These follicles will rupture, ovum is released.
Yes.
So at that time, if a lady has
Yes.
intercourse, she can conceive. In PCOS ladies, the
Yes.
follicles don't mature on that 14th day and rupture on 14th day. They prolong, they may present as cyst there only, or sometimes if they rupture also, it will take a long time, maybe 1.5 months, 2 months, whenever. And so the lady will not be able to find what her
Mhm.
ovulation time. And if she is not able to time the
Okay.
ovulation period, she will not be able to have timed intercourse, and so the conception is delayed. It is delayed, but
Did.
definitely possible. And since I've already told that this
Okay.
PCOS is a lifestyle affected disease, our life, by
Okay.
changing her lifestyle, that is coming bringing her way to an ideal one, that is not becoming obese,
Mhm.
keeping her lifestyle
Mhm.
active, not shifting from
Yes.
sedentary lifestyle to active lifestyle. So all of us are living a
Yes.
sedentary lifestyle now. We have cooks back
Mhm.
home, don't
Correct.
work back home. Here in the hospital again,
Yes.
we are busy, we are keeping ourselves only
Agreed.
sit and little stand, we are having a
Yes.
sedentary lifestyle.
Yeah.
So
Yeah.
we need to make our
Yeah.
lifestyle active one, and we need to exercise at least half an hour a day, not heavy exercise.
Yes.
Simple aerobic exercise or so, because heavy exercise itself is a detrimental factor. Actually, her PCOS
Okay.
will worsen. The big
Okay.
athletes and all will have were prone for PCOS
Mhm.
because they exercise too much.
Okay.
So moderate
Too
exercise,
much.
good dietary habits. Our dietary habits are worst
Mhm.
nowadays. We hardly cook. Most of us don't
Mhm.
cook. We all bring the processed foods
Yes.
and all sugary items.
People don't have that much
Hardly.
time to relax and cook. Yeah, but
But
you
this is
have
the
rightly
price we are
mentioned.
giving for our
Yeah.
PCOS is the price of
Yes.
our unhealthy
Mm.
lifestyle, sedentary lifestyle, unhealthy, faulty dietary habits,
Yes.
and so much of stress is there. You see, have to reduce our stress also. Everything is
Yes.
stressful because of nowadays we are in a nuclear family, nobody to share our problems,
Yes.
and we
Problems.
don't have anybody
Yeah.
back home. Even if we are having husband, wife,
Yes.
kids, all are busy. All for everybody is busy. We
Yes.
don't have anybody, and there is so much of
True.
competition out everywhere. Maybe
Mm.
hospitals, maybe software company, wherever the competition
Yes.
is so high. We have to keep on proving ourselves every day. The day we are little relaxed, we are out of that business. So much of stress, you see.
True.
So this stress really plays a very determinantal factor for ovulation and
Yes,
all.
ma'am.
So this PCOS lady will have to correct her lifestyle first,
Mm.
then learn to time her ovulation. This ovulation can
Mm.
be identified.
Yes.
Something like she will have a little body temperature is raised
Mm.
during ovulation
Mm.
period. Cervical secretion, that is vaginal secretion, will become little watery sort of,
Mm.
and she will. There are nowadays kits available
Mm.
to identify ovulation period.
Yes.
So with that, if she can identify when she is ovulating, and if she has regular intercourse during that period,
Mm.
with correct lifestyle
Yes.
changes, it is possible for her to conceive naturally.
Okay.
Little difficult, little delayed, but definitely she can conceive
Okay.
naturally with lifestyle changes.
Okay.
Answer.
Thank you so much, ma'am, for explaining the things in a so elaborative form. As you have rightly mentioned, that nowadays there is performance pressure everywhere. Either it's home, either it's kids, either it's family, either it's work. Everywhere there is such pressure, and which gives rise to stress. And then we should take some time out for ourselves, and we should put some time on ourselves for our health to this answer, ma'am. We have a question on our chat box, that what should to do control PCOS. Right now you have answered the question, ma'am, right now, but again, if you want to.
Change our lifestyle.
Yes.
I will always stress on change our lifestyle. It's
Yes.
a lifestyle disorder. Polycystic ovarian syndrome, it is an hormonal disorder, agreed,
Mm.
but it is affected by our lifestyle.
Yes.
Because lifestyle changes like sedentary life, we should change, have
Mm.
exercise, then food and all,
Yes.
will improve insulin resistance, which is the key factor in PCOS.
Okay.
Insulin resistance will be improved with this exercise or correct diet, which
Mm.
will reduce insulin resistance is reduced, androgen levels will come down.
Yes.
If the androgen or male hormone
Come
levels
down.
come down,
Mm.
our ovulation occurs in a proper
Mm. Yes.
way, and all the symptoms come down. Androgen level plays and hirsutism and all those problems because of androgen will come down. So the
Yes.
main
Mm.
is that life is
Yes, ma'am. Thank you so much, ma'am, for explaining this whole thing in such a simple and in such a elaborative form. Thank you so much for this. This question reminds me of another question, which is a matter of concern nowadays. That is, um, just a second. You're there, ma'am. You're there. Are you there, ma'am? I guess there is some internet connectivity issue. You there, ma'am? Am I
yeah.
audible to you? Yeah, I guess there
Yes,
was
yes, you're
some connectivity issue in between.
right.
Yes. So my next question
Okay.
to you is, ma'am, does PCOS increase the risk of miscarriage or pregnancy complications?
Yeah, sadly, yes.
Yes.
PCOS are fold increase of miscarriage. Why is it so? Because
Okay.
hormonal include male hormones are more, H is
Mhm.
increased. Definitely, these ladies are at risk of miscarriage. We
Okay.
really need to diagnose them early as pregnant and treat them properly. So awareness is very important here. Yes.
Yes. Yes. This gives a lot of, to think about. But moving forward, I would like to ask about some like for example, how can lifestyle mention like exercise you have just now mentioned can help in managing PCOS symptoms and in mentioned that we should be more focused on the many things which are going on. Am I not audible? Am
Satakshi,
I audible?
able to hear properly. Yes. Now,
Just a second,
for
ma'am.
some
Just a
next.
second. Okay. Ma'am, can you
Yeah,
please check the network connectivity by
now
yourself?
from my side, it's fine. I'm able to hear right now. We are fine. Yeah.
Yeah,
Yes.
it's fine for me too, ma'am.
Okay, beta. We are fine.
Yes. Yeah, yeah. So right now you just mentioned about the lifestyle changes, right? Like diet and exercise, how it can help in managing the PCOS symptoms and how it can improve the fertility also, as you have taught us right now about the androgen. But ma'am, nowadays people are very much concerned about their diet also because they are aware with the fact of insulin resistance, and thanks to our internet for this they have given lots of
Yeah.
social media awareness thing. So people are telling that we should include lots of fiber in our diet so that it could help in insulin improving our insulin resistance. So what's your thought
Yes.
on this, ma'am? Like salads and everything.
Yes, yes. So, diet definitely plays a very, very crucial role in PCOS because all sugary. Because today's lifestyle is full of refined food, sugar, sugary food, less fiber, more fat, and all this. So, why is it so? Because
Yes.
again, these are all high glycemic index food. Actually, I will tell the best
Okay.
diet. If there is somebody asking me, kindly tell me a proper diet for PCOS. It is something written there. So I
Yes.
would tell,
Yes.
see, PCOS, as I've told in my MBBS, they what did I tell? PCOS was not seen. Our grannies and our moms, did they have PCOS?
Yes.
No. I
No,
don't know.
ma'am.
1990s, there were not many PCOS cases.
Yes.
Why was it so? I have already told that genetic predisposition is there. They also belong to the same genetic pool. But why did not they have and why do we have right now?
Yes.
It's because lifestyle changes. See, they used to have proper sattvic food. What is that food? I would advise we should again go back to the same food. Don't get attracted with this gluten free and what all is marketed in this thing. I will tell go for your regular homemade food what your grannies used to have and your mom used to have. What
Mhm.
is it? They used to have around 2 to 3 hours after they get up around 9 o'clock. They used to prepare food properly, and what all they
Mhm.
had same rotis and roti dal. Before that, we used to eat gajar salad. What is the same thing? What we said earlier. That is first start with salads, maybe gajar, maybe cucumber, maybe radish. Then eat food mainly jowar roti. See in our side, jowar, ragi, and all this
Yes.
full millet set is there.
Mhm.
Prepare something
Mhm.
millet roti.
Mhm.
Eat lots of dal. Dal is
Mhm.
good for protein. Then it is not
Yes.
that we should not have rice and all. Do have rice and avoid sugar. 3 times eating, I
Yes.
think you should stick on to. Of course, it is said that milk should be avoided. Many people tell me should milk be avoided in PCOS dairy products. Yes,
Yes.
uh, you go for more of plant food. Now, why is it
Okay.
so? Milk contains milk. Actually, you see, it is all about if we have a cow back home,
Mm.
which is desi cow, and her milk. If you are drinking, I think that should be fine. See,
Yes.
but most of us get milk which are packed, and dairy farming is a very it's a big factory now. They
Yes.
get all that. Just it is that Western cows they get, which are given injected with hormones and antibiotics and everything. The hormones which they get is secreted in their milk and affecting we females who are especially milk, why it is, I think it's the from farming, dairy farm is having all this hormones. Also, it has growth of factor. That's the reason or not. Many people will ask gluten-free diet is a, it's a big market now. So it is nothing like that. Chapati,
Yeah.
avoid. Many of them
Mm-hmm.
tell her, don't eat wheat. What does it contain? It is gluten.
Mm.
So nowadays it is you
Gluten.
can
Mm.
have wheat. It is not that don't have, but go for organic. Our farming. Where is it possible now? It is not possible. But instead
Yes.
of wheat, you can go
Yes.
for jowar, ragi, and all the
Mm-hmm.
millets. It's not
Mm-hmm.
that stop eating. You
Mm-hmm.
can have, but it is rich. It is having more gluten and that. So avoid what we tell, and avoid all that food,
True.
extra sugary food, cakes and pastries and all refined
Mm.
food, bread and everything, white bread and everything, pastas, what we get from out them. Avoid everything
Mm-hmm.
from outside. Eat normal, healthy food which is made in home, and that's it. No special diet. Routine food, what we have back home is enough. Dairy products should be avoided. Go for oat milk, badam milk. I mean, the coconut milk instead of normal dairy milk. That's, I think that food should be good. Avoid alcohol, avoid caffeine because again they will affect the hormonal imbalance.
And everything now and
Yeah, yeah. Instead of the routine milk what we get from cow and buffaloes, go for this kind of milk, plant origin milk. Avoid
yes, ma'am.
wheat, but go for ragi and jowar and wheat. I mean, if at all you're eating meat, not a heavy fat one, go for a lighter meat,
Mm-hmm.
red meat sort of. Then best
Yes.
thing is
Yes.
I would like always go for sattvic food, that is pure vegetarian
Yes.
plant food.
Rightly mentioned.
Right, that's it. And that should be
Correct.
in
Correct,
diet.
ma'am.
I think so. If anything positively, if you
Yeah.
want us, I'll
No, ma'am, I'm highly agreed to you on this point because nowadays people are, very much involved in their work. They suddenly order something from Swiggy and Zomato and they have it, and
Mm.
after some time they suffer from diseases such like PCOS. So definitely we
Yeah,
should
yeah, yeah.
eat food
Unhealthy.
that is low on glycemic index and everything. We should take care of that. As you have mentioned, that Jabar Bajra thing, people used to eat that before, but now again it's being on the trend for the health conscious people. So thank you so much for explaining that thing. I'm sure Mr. Arvind and Mr. Shantu might have got their answer with this.
Yes.
Okay, ma'am, my next question to you is, like, what are some specific food habits which you have mentioned right now, and what role does insulin resistance play in PCOS? Can be managed, and I'm sure you are, like my viewers found that answer, which insulin resistance and the process and everything. Which are any other point which you think should be considered? Please, you can take this point, ma'am. This question.
So, insulin resistance is seen in almost 90% of PCOS patient will have insulin resistance. This insulin, most of them will like insulin. What it does is it will shift the glucose which is in the bloodstream. Once we eat, the food we eat is converted into glucose, and that is flowing in the bloodstream. The glucose from the bloodstream is shifted into the
Mm-hmm.
body cells with the help of insulin. And this
Mm-hmm.
in PCOS, there will be
Mm-hmm.
insulin resistance. So insulin will not be able to shift the glucose which is present in the
Mm-hmm.
bloodstream to the body cells. So more and more glucose is flowing in the bloodstream. So what does pancreas do? Pancreas will send more and more insulin again. At least now we can shift the glucose back into the cell. So that is not happening. And so
Yes.
insulin resistance is there, which is leading to excessive glucose. This excessive glucose is again stored as fat,
Mm-hmm.
leading to obesity. This insulin, which is excessive, will go and act on the ovary to produce male hormones. And this male hormone will again
Mm-hmm.
act on the follicles, and no follicle maturation and no ovulation, leading to infertility. So the final
fertility.
overall problem, everything stands with insulin here. If insulin is
Insulin resistance.
resistant, it is producing androgen hormones and infertility and everything. Insulin
Mm,
excess, so more glucose,
mm,
which is stored in fat cells, and obesity. So overall, the culprit here is insulin and insulin resistance. This is how insulin resistance will
yes.
affect all the problems: excessive androgens, anovulation, and acne. Everything is because of insulin and
Mhm.
insulin resistance.
Okay, okay. That clears a lot of confusion, ma'am. Thank you so much for again explaining and taking this point in consideration of the question. So now let's talk about something which is equally important about the mental health and awareness. Nowadays, people are more stressed because of their work and personal life. So, how does PCOS impact the mental health, and what support is available for women dealing with these challenges?
So PCOS patients are usually depression patients, depression and anxiety. They have either depression and anxiety. Why is it so? Because of all the, see, any woman, first thing what she will have is her looks and everything. First they affect because of acne, hirsutism, excessive hair, obesity and all. Because of these health issues only she will land up. The young girls will land up into depression because of these health issues. They do look fat, they look
Mm,
ugly because of excessive hair, face hair, or excessive hair on the body, hair loss, and menstrual
mm,
cycles which are not regular. These people will have acanthosis nigricans, that is black thing over
mm,
the back of neck. So all this look
mm,
first matters for the young girls, young adolescent girls who are having PCOS. Because of this reason, they go into depression. And this
mm,
hormonal imbalance itself, androgen excess and LH excess, this hormonal imbalance will produce depression because of hormonal changes. And later on in life, because of inability to conceive, that
mm,
is one more big thing for which most of the females land up into depression. And depression and anxiety is a part of PCOS patient. Most of the PCOS patient, for whatever reason it is, they will be having depression and anxiety. And it is to a certain extent because of the symptoms, and mainly because of the hormonal changes which are seen, androgen excess which is seen in PCOS. Because of these hormonal changes also, they will have changes leading to depression and anxiety. And this can be handled, of course, again with having good diet. Again, this good diet will reduce their obesity, and good diet will reduce the hormonal changes. And they should exercise every day. You see, exercise will release serotonins and endorphins. These are called happy hormones. Of
mm,
course, exercise will reduce blood glucose and reduce weight and help everything, weight
mm.
reduction and obesity. But exercising every day, exercise, during exercise endorphins are released. You must have heard of
Yeah.
endorphins, and serotonin is released
Yes,
during
the happy
exercise.
hormones.
It is happy hormones.
Yes,
So again, how to combat with depression and anxiety of PCOS is doing exercise
excellent.
every day, having good diet, and also doing yoga and meditation to certain extent will give us mental support. And
Yes.
definitely drugs are there. I
Mm,
think again lifestyle changes will help most of the PCOS patients
yes.
to combat with their depression and anxiety. Drugs will be there with any of these. We should not hesitate. Only lifestyle changes will not improve. Definitely, don't hesitate going to doctors. Please go to doctors and consult with your problem, and take medications, which is given by us. But definitely, lifestyle will help. And depression and anxiety is a part of PCOS, which almost everybody will be having to set to at different levels.
Yes, ma'am. Yes, ma'am. As you have mentioned, like small tips you have given right now. If we happen to incur that changes our simple lifestyle, I am sure that people will be more confident about their looks, also about their, how they are doing in their day-to-day life, and they will overcome the depression and stress as well. Thank you for sharing that perspective, ma'am. Thank you so much. Yet another questions which often comes up is what can schools and community do to improve awareness and education about PCOS and reproductive health? And why it is that stigma associated with PCOS? Why people or maybe the women's of middle age or maybe pubertal age women, like ladies are now developing, girls are now developing this disease? Why there is some taboo on discussing this thing? What we can do to overcome all that?
See, we are living in a society which is with some beliefs like social stigma. There is a
Correct.
society, cultural, religious belief that
Yes.
talking about reproductive health or contraception or sexual
Mm.
problems is wrong, or
Mm.
it is they're judgmental about it, and it is
Yes.
mainly because of the belief what is there in the society. This society, there is society problem, society,
Yes.
there is a religious belief that we should not talk. This is very we are judged actually by when we talk like this, talk
Mm.
about these problems,
True.
and that's the reason I think that's the major stigma for everyone to come and approach. They don't take these problems as health issues, they take it in a different way. Sexual
Yes.
problems, health issues, contraception are health issues actually according to us. But
Yes.
people take it otherwise. They take it as something very shameful, something it's sexuality, or they are judged by talking about this, and that is the main reason where for which the girls don't come out and they ask their questions. And
Yes.
because they don't come out and ask their questions, they are misunderstanding. They are not understanding the proper disease in a correct way. When they don't get the problem in a correct way, it is biased that the treatment is delayed or diagnosis is delayed or they will land up in some
Mm.
problem. So here it is, I
Yes.
think it our society. We are again by awareness, giving talks, and see September. This September is PCOS month, which
Yes.
is known as September PCOS awareness month. All over the world, to talk about PCOS, go to schools and colleges and people wherever women gather,
Yes.
go there and give awareness about PCOS. What is it? How to diagnose? What are the treatment available? And that is how we can
Yes.
bring down the stigma and
Correct.
improve the early diagnosis and treat. And one more thing, Satakshi, diagnosis is not just for infertility and all. See,
Yes.
PCOS is not limited to just menarche to menopause. It is related
Yes.
throughout life because these
Right.
PCOS ladies are bound to develop diabetes mellitus in future. They will have
Okay.
hypertension in future. They will have
Mm.
more prone for cardiac disease in future. They will have
Okay.
liver disease. So early
Okay.
diagnosis and management is very important, not just for her to become pregnant and lose
Mm.
some weight or acne and hirsutism. It
Yes.
is for a lifelong problem. You see, lifelong she will have later on she will develop diabetes, hypertension, cardiac disease. She will end up
Mm.
into depression and liver disease is seen. So because of all this, also early diagnosis is essential, and for which we
Mm.
need to conduct programs like the one you are conducting today,
Yes.
awareness
Yes.
programs to reach
Correct.
outreach programs. People, we should go and
Yeah.
talk to them, create awareness, and see that
Yes.
diagnose PCOS early.
Yes,
And
rightly mentioned, ma'am. We don't know. We are just figuring it out in our mind that yes, one person have been suffering from PCOS, but it could be very fatal. As just now you mentioned about the cardiac thing, and just now you mentioned about the liver disease or maybe other disease because of this. So we must take care of ourselves, and we must should focus on our health as a priority. I'm sure, ma'am, all your answers are very, reassuring for our audiences today. And my last question to you is, which are looking ahead question, that what advances in research or treatment will give to women struggling COS related to infertility?
so earlier when I started my talk, I told PCOS is a hormonal disorder. Now, with later the research going on,
Yes.
people have started telling us PCOS is a metabolic and endocrine disorder affected by genetic and environmental factors.
Okay.
So, and it is a
Mm-hmm.
lifelong disorder. First, what I told was it is a
Mm-hmm.
disorder seen from menarche to menopause. It was understood that only that much. With research, it is understood that it is a metabolic disorder, endocrine disorder affected with genetic and environmental or lifestyle factor, and it is lifelong disorder. So we need to be now even reactive treatment. Like we used to find the symptoms and treat,
Mhm.
but now on, like even before the
Okay.
symptoms come, even before anything, identifying the risk factors, genetic whatever, and see there are many drugs coming out to reduce insulin resistance or to reduce weight and so many things. But ultimately, what is
Yes.
more important is uh, again lifestyle is again the only thing which we can do.
Yes.
Drugs are there, medicines are there, but medicines are to be
Mm.
avoided till we can diagnose yourself to have PCOS, or
Yes.
are you prone for PCOS. See that you will change your lifestyle and you keep the symptoms reduced. See, as I've told, there is no cure. If you are prone for PCOS, you are prone for PCOS, there is nothing to be done. But we can prevent the symptoms and complications to occur by changing in the lifestyle. Drugs are there. If you go to doctors, there are many drugs coming which will reduce the insulin sensitivity, which will reduce the weight, and so on. But I would still, there is also one
Yes.
more saying, chronic inflammation can be reduced, gut uh, microbiome. There are some studies are going on. There are many studies going on, but ultimately the fact is change in lifestyle is the first key to reduce the symptoms and improve the fertility. And also, if we improve our lifestyle, all the diabetic we'll never get our diabetes, because I told I'll get diabetes in future, hypertension in future, cardiac problem in future. All this can be
Yes.
reduced by good diet, liver diseases. Healthy eating, liver disease is reduced. Healthy exercise, cardiac problems is reduced. So diet, good diet,
Mm.
diabetes is reduced. Overall, everything is finally up to, I think, change in the lifestyle. Drugs are there. There are many
Yes.
studies going on, which we'll give once you come to us. I think.
Yes.
I think this.
Right. Yes, ma'am. Thank you so much, ma'am, for such an insightful and elaborative answers. I'm sure my audiences must be very thankful to you for this session because the answers which you have given to my all the questions so gracefully and taking it as a very, like very in a good way, in a positive way, you have answered all the questions. Thank you so much, ma'am, for this such a interactive session. Now we are towards the end of session, and while concluding the program, thank you all for being part of We Talk to You. We hope today's session on PCOS was informative and valuable in spreading awareness. A special thanks to Dr. Shail for sharing her time, expertise, insights with us today. For those who would like to revisit the program, the video will be available on our official social media platform, that is Puberty to Menopause, on YouTube, LinkedIn, and Facebook also. Please follow us on Twitter, LinkedIn, and Facebook, and subscribe to our YouTube channel. Do like, share, and spread the word as many, including your friends, family, and relatives. Until we meet in our next live talk, stay healthy, stay aware, and please take good care of yourself. And thank you, Dr. Shailaja, for joining us, from taking some time out of your such a dual. Thank you so much. We're delighted to have you on this platform, ma'am.
Thank you. The pleasure was mine. Thank you so much.
Thank
Thank
you.
you.
Thank you, ma'am.